USMLE style question. Death within to 24 hours post-MI due to ventricular arrhythmia. A 58-year-old man with a history of hypertension, hyperlipidemia, and smoking is found unresponsive at home. His wife states that earlier in the day, he had complained of crushing chest pain radiating to his left arm, but he refused to go to the hospital. Emergency medical services arrive and find him in pulseless ventricular tachycardia, which degenerates into ventricular fibrillation, VF. Despite multiple defibrillation attempts, he does not regain a pulse and is pronounced dead. Which of the following is the most likely cause of this patient's sudden cardiac death? A. Myocardial free wall rupture. B. Ventricular fibrillation due to electrical instability. C. Papillary muscle rupture leading to acute mitral regurgitation. Cardiogenic shock due to left ventricular failure. E. Complete heart block due to infarction of the conduction system. Answer: ventricular fibrillation due to electrical instability. Explanation: this patient most likely suffered a myocardial infarction, MI, followed by ventricular arrhythmia, leading to sudden cardiac death, SCD, within the first 24 hours. The most common cause of sudden death within 0 to 24 hours post-MI is ventricular fibrillation, VF, due to electrical instability. Pathophysiology. Why does VF occur post-MI? Ischemia from an acute MI disrupts ion channel function and creates areas of heterogeneous conduction, increasing the risk of reentrant circuits. Reentrant ventricular tachycardia, VT, can rapidly degenerate into ventricular fibrillation, VF, leading to cardiac arrest. Electrical instability is most likely to occur within the first 24 hours post-MI. Without immediate defibrillation, VF is fatal due to the loss of cardiac output. Why the other answers are incorrect. A. Myocardial free wall rupture typically occurs 3 to 7 days post-MI when macrophage-mediated degradation weakens the infarcted wall, leading to cardiac tamponade. It is not an early complication. C. Papillary muscle rupture leading to acute mitral regurgitation occurs 3 to 5 days post-MI, usually in inferior MI due to right coronary artery occlusion. Presents with acute pulmonary edema and cardiogenic shock, not sudden cardiac arrest. D. Cardiogenic shock due to left ventricular failure. LV failure can cause shock, but is not the primary cause of sudden death within 24 hours. VF occurs more often. E. Complete heart block due to infarction of the conduction system. Conduction blocks, e.g. from infarction of the AV node, can occur post-MI, but they usually cause bradycardia, not sudden cardiac arrest. Key takeaways. Ventricular fibrillation, VF, is the most common cause of sudden cardiac death, SCD, within 24 hours of an MI. Ischemia-induced electrical instability increases the risk of reentrant ventricular arrhythmias, VT-VF. Immediate defibrillation is the best treatment for VF to restore a perfusing rhythm. Would you like a follow-up on post-MI complications?